Aneuploid embryos are usually not allowed for transfer, but this couple transferred 1 euploid and 3 aneuploids, and 2 aneuploids led to 2 healthy babies. Let's go through all the details together now. So let's start with the facts of this case. This was a 42-year-old female and a 49-year-old male. They had 5 children, 3 boys and 2 girls. Unfortunately, one of their daughters passed away in a drowning accident. They wanted to continue to grow their family, and specifically, they wanted another daughter. So they went to a fertility clinic and they started IVF. Their first round of IVF resulted in 1 embryo for testing. It had a male result with chromosomally normal PGT-A findings. Their second round of IVF resulted in 3 embryos for genetic testing. All were female, but they all showed abnormal PGT-A results. I've got those results on the screen so you can take a look at the details. After genetic counseling, they decided to transfer all 4 embryos at once, and they got pregnant with twins. They gave birth to 2 healthy girls, and genetic testing after birth showed normal results on a karyotype and a microarray. The girls were 7 years old when the case report was published, and they were currently healthy. Now I want to share just some of my insights as a genetic counselor with expertise in the area of PGT-A and aneuploid results. The first thing that comes to mind here is that at least one of these embryos is expected to have been conceived from one of the embryos that showed a whole chromosome aneuploid result. I'm going to assume that people who are watching this video have some understanding of the nuances between these different result types, segmental aneuploid and whole chromosome aneuploid. If you're not sure what those things mean, there's lots of other resources on the DNAide website that can help you break down what those things mean. But generally speaking, whole chromosome aneuploid results are expected to have the lowest success rate of all types of PGT-A results. And so knowing that one of these embryos, if not both of them, led to the birth of these twins is very noteworthy for this case. I think it's important to comment on some of the things that we don't know in this case. It's always important to keep a healthy amount of skepticism, and that's just important for me to share in this. Firstly, we don't know what genetic testing lab was used for this testing, and the testing was done in 2017. There have been a lot of advances in genetic testing that have happened between 2017 and today in 2025. There are also differences in how labs can do PGT-A and how they can handle reporting of PGT-A results. And there isn't a lot of discussion in the case report of some of the nuances that could have possibly led to inaccuracies in testing, or what might have resulted in an embryo with an aneuploid result, especially whole chromosome aneuploid, leading to the birth of one or both of these healthy girls. One of the things that stands out to me is that both of these whole chromosome aneuploid embryos had results that included chromosome 18. They were minus 18, but that's not necessarily relevant here. In the past, some PGT laboratories had policies where if an embryo had abnormality involving chromosome 18, they might call that embryo aneuploid when in fact it was mosaic. And so that is something that I keep an eye on. If I had a report in front of me and it was from 2018, it would be important for me to be reading the fine print to see if there was any comments on how specific chromosomes are reported. Is mosaicism going to be masked for that specific chromosome, or if that specific chromosome is involved? And since I work with a lot of older testing, with lots of different laboratories, there are just certain things on my radar like that. And it's usually pretty clear in the fine print when I know what I'm looking for that something like that might be hidden. I hope that the researchers would have commented on that. If there was a chance that mosaicism would have been masked for one of these embryos, that they would have made that very explicit. And so I hope that's not the case. But since I don't have a lot of information, sometimes it's a little bit fun to speculate, and just to share for people out there who might be wondering what could be going on for some of their embryos, the thought process for myself when I'm looking at older reports. So, how does an embryo with an aneuploid result become a euploid baby? There are lots of different reasons that this can happen, but the first that I want to talk about is the possibility that the PGT results were accurate and the girls ended up being chromosomally normal as well. This can happen due to what we call embryonic mosaicism, the possibility that the sample tested was completely abnormal, the PGT results were correct, but the inner cell mass, the part of the embryo that would eventually develop into the baby, was chromosomally normal. This would mean that there were different cell lines within the embryo, and the part of the embryo that they tested didn't match the part of the embryo that eventually became the baby. This is a crucial part of PGT research. We call this concordance. What's the chance that the sample tested matches the rest of the embryo, and often more specifically, the inner cell mass? For whole chromosome aneuploid results, concordance is usually quite high. In a lot of the research studies that have been done, usually the sample tested matches the rest of the embryo. But concordance is never 100% and can be a reason for PGT results not matching pregnancy outcome. And this can go both ways. It can mean that an embryo with an abnormal result leads to a baby with normal chromosomes, but it can also be a reason for an embryo with a euploid result that is chromosomally normal, leading to a pregnancy that has a chromosome difference that should have been detected by the PGT-A. Continuing to think about other possibilities of how this pregnancy happened, it's always possible that PGT-A can misdiagnose the sex chromosomes. So it's not impossible that the embryo with the euploid result actually led to the birth of one of these twins. But even though it said on the testing that the embryo was male, it could be female. It's possible that there was a sex discrepancy on the PGT-A, and that's what led to the birth of one of these twins. Keeping up with the thought that there is some healthy skepticism involved when analyzing any case report or research paper, one other possible explanation for how this couple conceived could be that there was a spontaneous conception, that they conceived without assistance, and that their embryo transfer was actually unsuccessful. That is certainly a possibility if the couple wasn't counseled that they shouldn't be, trying to conceive without assistance. There wasn't discussion in the paper that this wasn't a possibility. It just wasn't mentioned at all. And so we don't have detail on whether this couple had infertility or if they were seeking fertility care because they had a preferred sex and possibly because of advanced reproductive age. And so it's not impossible that this couple conceived without assistance just around the same time as their embryo transfer, and that their embryo transfer was actually unsuccessful. I'm speculating. I was not involved in this case at all, but it's just always something that we have in mind. And without it being mentioned in the case report that that's definitely not what happened, we'll never know for sure. Sometimes in more up-to-date genetic testing, there's actually a way that you can take the embryo sample from PGT and then a DNA sample from the child or the pregnancy and match them. So confirm that the kind of PGT result, the embryo test, matches the person that's in front of you, and then you confirm that the embryo transferred actually resulted in the pregnancy. So that would be really cool to know. But given that it was done in 2017, it's been so long now, that technology is probably not available. Something else to note is that one of the aneuploid embryos that was transferred is, in fact, a segmental aneuploid. We know, based on research today in 2025 and from a few years ago now, that embryos with segmental aneuploid results do have a higher chance of leading to healthy live births compared to whole chromosome aneuploids. So if these three embryos were in front of me and a patient was wondering, which one of these embryos might have the highest chance of success, that segmental aneuploid would absolutely be standing out to me as potentially a candidate for transfer after thorough genetic counseling. And so if I saw these three embryos together, I wouldn't be surprised that one of them might have led to a live birth. The early research that we have so far is showing between a 22 and 24% live birth rate for segmental aneuploids. I think what's surprising is the twin pregnancy. Again, as I said before, knowing that one of these embryos that was whole chromosome aneuploid led to a live birth, knowing that they typically do not do that. But no test is 100% accurate. There are always limitations, and this really shows that even with the lowest chance of success, that's not a 0%. And in this case, that meant two healthy babies for this couple. So because this was such a successful outcome with the transfer of these aneuploid embryos, and it was a surprise to the fertility clinicians involved, they ended up creating what we now refer to as the TAME study, transfer of aneuploid and mosaic embryos. They recognized that a one-off success doesn't really help us understand how often the transfer of these embryos is successful, and so they wanted to get a better idea of that. And so they now accept transfer of mosaic and aneuploid embryos. There are certain criteria that have to be met, and you have to undergo your care at Stanford. But this case certainly inspired them to perform this research study. And because this was a twin pregnancy that can inherently have some risks because of the fact that there are two babies at once, they now only allow for one embryo transfer at a time because of what they've learned from this case. So very cool that this success for this couple inspired the creation of this study that a lot of patients rely on for the transfer of their embryos that are not allowed for transfer in other locations. So I love this case report. It is so cool to see that these embryos that usually are given no chance at all were able to help this couple complete their family in a way that is quite unexpected, and just goes to show that embryos with aneuploid results, even if the success rates are low, can sometimes result in healthy babies. It's important that people get thorough genetic counseling when they're considering these embryos for transfer so that they can make sure that that decision is best for them, but it really highlights important considerations about PGT-A. I'm curious what questions you have about this case, what your thoughts are about PGT-A and aneuploid results in general. Let us know below. And if you're interested in reviewing your PGT-A results so that you can make an informed decision about how you want to move forward, visit our website at DNAide.com to book an appointment.